Welcome back to our next video in our series of conversations with LGBTQ plus affirming and inclusive organizations and resources here in Clark County. Today, we are very lucky to be joined by Jasmine from CAP Northwest. Hi, Jasmine.
Hey, Austin, thanks for having me. Happy to be here.
So Jasmine, can you introduce yourself and tell us a bit about CAP Northwest and your services?
Yeah, sure. Hi, everyone. My name is Jasmine Gruenstein, she, her pronouns. I am the manager of prevention and integrated services at CAP, Southwest Washington. CAP stands for Cascade AIDS Project. So we are a nonprofit. We're the oldest and largest AIDS service organization in Oregon and Southwest Washington. So CAP spans across two states, Oregon and Washington, and then also several counties within each state. And I'm a manager at our Vancouver office, which is right in downtown. We've been around for about 5 years now, and we have a myriad of services serving folks living with HIV and AIDS, and also what I oversee is the prevention side, which is everything sexual health related, HIV, STDs. We have an STD clinic that I'll get more into later. We also have PrEP navigation and just lots of resources for folks that are interested in accessing sexual health care.
Wonderful. And I know that you offer free and confidential testing services at CAP. Can you tell folks a little bit more about that and how folks could access services, make an appointment, walk in? Do they need to bring things with them?
Sure, yeah. So like I mentioned earlier, we have an STD clinic in downtown Vancouver, and we'll have some of that information. Austin will send it out, but it is in the Peace Health Memorial building on the corner of 33rd and Main Street in Vancouver. And we just reopened. So we shut down like many places did for COVID about 15 months ago. Our clinic shut down and we've been closed this whole time. And we just reopened a few days ago on Tuesday, June 29th. So super thrilled to be reopened to the community. So if you are interested in coming in for testing, our services include a rapid HIV test, which takes 20 minutes, and you will get your HIV results that day. So before you even leave the clinic, you will know your status. So we love being able to provide those to folks super quick. And then we also do screenings for chlamydia, gonorrhea, and syphilis. And all of those take about a week for those results to come back. And that's some swabs, throat, rectal swabs, depending on what type of sex you have, and then also urine collection. And then syphilis is a blood draw from your arm or your hand. So all of those things are free and confidential, just like Austin said. And so you don't need to have insurance. And unfortunately, our services are not anonymous. So there was a time back in the day at the height of the AIDS epidemic when folks could get anonymously HIV tested. We're not doing that anymore. We just so this is because we partner with Clark County Public Health. We want to make sure that we're giving you the care that you deserve and we can have follow-up with you. So if anything comes back positive, we need to be able to contact you. So that's why we ask for your name and your demographic information, your address and your phone number, things like that. So we will ask for that. There'll be some paperwork involved. However, you don't need insurance and you don't need to pay anything, and everything is confidential. So the only piece that we ask for you to bring in is a piece of identification. It doesn't need to be like a driver's license. It could be your student ID, something that has your name on it. That's all we're asking for.
Great. Well, and thank you for explaining to the difference between anonymous and confidential, that all the information people share is going to be kept private and confidential, but that folks do need to, give some information like their name and their address just for follow-up. So thanks for mentioning that. Yeah, and I'm wondering if you can talk a bit about PrEP navigation and how folks can get support for accessing PrEP.
Yeah, definitely. So just quick blurb on what PrEP is, just in case folks don't know. So PrEP stands for pre-exposure prophylaxis, which is a fancy name, but what it means is it's an HIV prevention tool. So another way we describe it is the birth control of HIV. So essentially, if folks are interested in PrEP and they're having multiple sex partners, they don't like to use condoms, etc., other high-risk activities for possibly acquiring HIV, we will my staff can connect them to a primary care provider in Vancouver that can then write them a prescription to get this medication. It's 1 pill a day. So if you are interested in that and you're like, that sounds amazing, it's really cool technology. It's been around for about 6 years, FDA approved, and it's really truly amazing. So it's another, again, like tool in the toolkit for protecting yourself and taking control of your sexual health. And the other really cool thing about it in Washington State is you can get PrEP for free, completely free. So even if you're going to a doctor, you're getting some labs done, which we can talk more about if you get connected to a PrEP navigator, but you're getting some medical stuff done. All of that is free. And then you go to a pharmacy, get the medication in your hand, also free. So you're not going to get a bill in the mail, which normally this medication is hundreds and thousands of dollars per month. So it's really awesome that Washington State is on board with making it accessible for folks. And there is a form that we will send out that link, but there's a form that you can fill out online if you're interested in getting on PrEP. And then one of my team will reach out to you and we'll get that process started.
That is really great information to share with folks in the community. Thank you for giving us the update on PrEP and PrEP navigation. And so you said that folks can apply to get some assistance with that right online. We'll put that link in the description of the video. We also, I think there's also ways folks could reach out if, say they just had questions, say they wanted questions about PrEP navigation or services for folks who are living with HIV. What's the best way for folks to get information or to connect with you?
Yeah, totally. Great question. So I would say for anything that is PrEP related, that you're just like, tell me more about it. I want to know what, possible side effects are. Can I get on it and then get off of it, or whatever questions you have? I would still fill out that form that we talked about earlier. And then my team, this is what they do. This is their professional work. So they are experts when it comes to PrEP and sexual health. So they can follow up with you. And even if you're not committing to doing anything. So if you're like, I don't want to get on it, I just have some questions, that's totally fine. So if it's PrEP or testing related, I would fill out that form. There's also a separate form for specifically if you want an appointment during our clinic. So 2 different Google forms, one for PrEP, one for testing. So those are your options on the prevention side. And then if you are someone that is living with HIV, or someone that's living with HIV or AIDS, and you have questions about our services for that, which include, by the way, a myriad of things such as medical case management, which means we can connect you to a primary care provider that does HIV treatment. And again, that would be free. All of these things are free. So medical case management for folks living with HIV. We also have housing support for HIV positive folks, peer support for folks that have lived experience and can really help with the mental health side, the substance use side. And then we also have an employment services program that I oversee that can help folks either that are interested in PrEP on the prevention side or living with HIV and are maybe looking for a job, want to figure out how to apply for unemployment, need to update their resume. So lots of services. So any of those that I just mentioned, there's a phone number that is our direct line to our Vancouver office, and that will also be with all the other information below. And that phone number is the best way. That's our main reception line. And then we can direct it to whatever staff person is the most appropriate for what you're interested in talking about.
That is great. Well, I am also curious to know in what ways and how does CAP Northwest ensure that they are LGBTQ affirming and inclusive? Because I know y'all do a great job with that.
Oh, thank you. Yeah. So, as you can, so I guess to give you a little bit of history or herstory about CAP, it was started with a handful of volunteers during the height of the AIDS epidemic about 35 years ago. So we're very grassroots in our start, and the majority of those folks were part of the LGBTQ community, and they mobilized and they organized to start this agency because they saw their friends and their chosen family and their family dying from this epidemic, and they weren't getting the services that they needed. So I would say at our very core as an agency, we've always been rooted in caring and showing up for this community. And a lot of our staff, and I think a huge way of perpetuating that care and service to that community is by hiring staff that are also part of the LGBTQ community. So the majority of our team is that, whether they're really strong allies or they are truly identify as part of that community. And then they have that lived experience that then makes it easier, I think, and more effective to connect with the people that we're trying to reach. And then in other ways, we're always trying to go to webinars and educate ourselves on the latest terminology, right? Everything is changing all the time. So we want to make sure that we're staying ahead of the curve. And and growing as well as an agency and as a staff, and also making sure that our space reflects that. So the artwork that we have, making sure that there are, two men kissing like in our artwork, things like that. It's not all like heteronormative. Like we're making sure that it reflects the folks that are coming through our doors. So those are some key ways. There's more, but I'll stop there.
That is all really excellent stuff. And I know that y'all do a great job and make a really welcoming and affirming space for folks. I'm also wondering if there's anything else you'd like to share with folks today.
Oh, COVID's been really hard. I will just say that for everyone. And I just want to acknowledge that. I mean, we're still doing a Zoom meeting, which is totally fine, but I look forward to the times that we can meet in person. And I guess I will just say that CAP is here for you. And we are so excited to be able to reopen our doors fully, to have our community back in and be able to serve you and give you condoms and lube and connect you to PrEP and test you and really just be there for you as a support system. I know that there's not always safe spaces for the queer community, period, but also in Vancouver specifically. So just know that CAP is one of those safe spaces, and we're happy to be there for you in whatever you need.
Well, thank you, Jasmine. We really appreciate your time and all your wisdom. If folks have more questions, want more information, you can check out the information in the description below, and we'll have some links to that PrEP navigation and HIV and STI testing information. And thank you so much for joining us, Jasmine.
Thank you so much for having me, Austin, and we will talk soon. Have a great day, everyone.
Take care.